Now let's discuss STIs. STIs used to be called STDs, which are sexually transmitted diseases, but because these are actually infections, whether bacterial or viral infections, and the person can be contagious without even developing symptoms of the disease, that name has been changed into sexually transmitted infections or STIs. Some of the common symptoms of STIs include burning sensation while urinating, pain in the lower abdomen, so pain in the pelvic area, pain, itching, soreness, ulcers in the genital area or in the anal area, discharge coming out of the vagina or out of the penis, sometimes things that are not related to the genital area. So, having itchy, runny eyes or swollen lymph nodes in the neck area. A pelvic inflammatory disease or a PID is a complication of some of these STIs, for example, gonorrhea or chlamydia, where those bacteria enter through the vagina, they enter into the rest of the organs, maybe even into the pelvic cavity, and they cause the inflammation, infection. They can cause scarring tissue due to fibrosis, and that can lead to infertility or ectopic pregnancy. Now, there are two slides that have a whole list of STDs or STIs, and what I would like you to know about these are obviously the names, so you want to identify them as an STI, and you want to know if they are viral or bacterial infections. So, HIV infection is a viral infection with the human immunodeficiency virus or the HIV. Chlamydia infection is by a bacteria known as Chlamydia trachomatis. This causes a very mucus, pussy kind of discharge from the penis or vagina, known as a mucopurulent discharge. These two, genital herpes and genital warts, are both viral infections. Genital herpes is by the herpes simplex 2 virus, and genital warts is by the human papillomavirus or HPV. Both of these viruses increase the risk of cervical cancer. Now, all three of these, gonorrhea, syphilis, and trichomoniasis, all three of those infections are due to different kinds of bacteria. And that means that they can all be treated with antibiotics. Syphilis has multiple stages. So the first stage would be a chancre, which is pretty much looks like an ulcer found on the genital area or around the mouth. And then it could proceed, if it's not treated properly, it could proceed to secondary or even tertiary syphilis that could involve the whole body, including the brain, leading to dementia. And that concludes chapter 22.